This is Dr. Kavanagh of Eye Associates of South Texas. I'm going to show you a case here of a BrightOcular Iris implant that was causing uveitis, glaucoma, and intermittent hyphemas. You can see there's a bright blue iris implant over the patient's existing iris and below the cornea. We're going to make a side port incision with a 15-degree blade, approximately 1.2 millimeters, to allow access of a side port micro grasper to lift the iris away from the temporal wound that we're going to construct. We fill the anterior chamber with dispersive viscoelastic, making sure to place viscoelastic above and below the iris implant to protect the cornea and protect the iris and lens underneath the implant. It's important to visco-dissect the two layers apart so they are easier to remove. We're going to make our standard 2.8 millimeter incision. We've kept the incision smaller than we have in previous iris explants because we plan to do cataract surgery after removing the implant. You can see here we have brought the iris implant up into the clear cornea wound, and we're going to use some micro scissors to transect the temporal side of the iris implant, and we want to make sure that we're completely through the iris implant, as we're going to carousel this out of the eye using a micro grasper. As you can see with the scissors, we lifted one of the tabs from the BrightOcular implant into the clear cornea wound, and now we're going to pull the implant out in total in one piece. You can see us removing this through the clear cornea wound and kind of turning it around through the 2.8 millimeter incision. Now we must take care at this moment, when half the implant is out of the eye, that we fill the anterior chamber, especially over the implant, with the dispersive viscoelastic to protect the corneal endothelium. We use a cyclodialysis spatula to keep the implant away from the cornea. And you can see here the implant is removed quite easily through a 2.8 millimeter incision. As you see, there is an area where the iris is stuck to the lens, the posterior synechia, and we will break this with the dispersive viscoelastic. The patient had an anterior subcapsular cataract as well as a nuclear sclerotic cataract that we have just removed. I've edited this part of the surgery out of this video, but you can see we place a symphony intraocular lens to give the patient back some level of distance and mid-range vision. Thank you for your attention. This is Dr. Kavanagh from Eye Associates of South Texas.